Unit 15 Neuro questions. 51. A client with a spinal cord injury that resulted in paraplegia suddenly complains of severe headache and nausea. The client is diaphoretic with piloreaction and flushing of the skin. The client's systolic blood pressure is 210 mmHg. The nurse immediately suspects 1. Return of spinal shock, 2. Malignant hypertension, 3. Impending cerebrovascular accident, 4. Autonomic dysreflexia. The correct answer is 4. Autonomic dysreflexia. 52. A client has experienced an episode of myasthenia crisis. The nurse would assess whether the client has precipitating factors such as 1. Too little exercise, 2. Increased intake of fatty foods, 3. Vomited doses of medication, 4. Excess medication. The correct answer is 3. Vomited dose of medication. 53. A nurse is performing an assessment of a client suspected of having trigeminal neuralgia. Which of the following assessment questions would elicit data specific to this disorder? 1. Have you had any numbness and tingling of your face? 2. Have you noticed that your eyelid has been dropping? 3. Have you had any facial paralysis? 4. Have you had any sharp pain or any twisting in any part of your face? The correct answer is 4. Have you had any sharp pain or any twisting in any part of your face? 54. A client with stroke has right-sided hemiplegia. The nurse plans to do which of the following to help the client adapt to this visual deficit? 1. Place all object within left visual field. 2. Place all object within the right visual field. 3. Ensure that the family brings the client's eyeglasses to hospital. 4. Teach the client to scan the environment. The correct answer is 4. Teach the client to scan the environment. 55. A nurse is teaching a client with myasthenia gravis about prevention of myasthenic and cholinergic crisis. The nurse tells the client that this is the most effectively done by 1. Doing all chores early the day while less fatigued. 2. Taking medication on time to maintain therapeutic blood levels. 3. Doing muscle strengthening exercise. 4. Eating large, well-balanced meals. The correct answer is 2. Taking medication on time to maintain therapeutic blood levels. 56. A nurse is performing a ankylocephalic response test on unconscious client. The nurse turns the client head notes movement of the eye in the same directions of the head. The nurse would most appropriately document these findings as 1. Insignificant, 2. Normal, 3. Abnormal, 4. Inconclusive. The correct answer is 3. Abnormal. 57. A client has just had a Foley's catheter removed and is to be started on a bladder retaining program. Which of the following prescribed intervention give the caregivers the most useful information about the client's ability to empty the bladder? 1. Calculating total fluid intake for the shift. 2. Measuring post-void residual using a bladder scan. 3. Assisting the scan to the bathroom every 2 hours. 4. Recording the amount of the client's voidings. The correct answer is 2. Measuring post-voidal residual using bladder scan.